Question 1. Research into the roles of various professionals in the disability management process reveals a common ethical dilemma. A certified disability management specialist, CDMS, is managing a complex disability claim for an employee. The employee's treating physician has provided a brief note stating the employee is unable to work due to a medical condition, but has not provided detailed diagnostic information, prognosis, or functional limitations necessary for a comprehensive assessment. The employer is pressing for more information to make a decision regarding benefits and return-to-work planning. What is the most appropriate course of action for the CDMS? Option A. Obtain explicit, written consent from the employee to request specific medical information directly from their treating physician, clearly outlining the purpose of the request and the type of information needed. Option B. Advise the employer to rely on their own assessment of the employee's condition based on the limited information provided by the physician, as further medical details are confidential. Option C. Contact the treating physician directly to request detailed diagnostic and prognostic information, explaining that the employer requires it for claim adjudication. Option D. Request the employee to provide a second opinion from another physician, as the current physician's information is insufficient for the claim. The correct answer is A. Obtain explicit, written consent from the employee to request specific medical information directly from their treating physician, clearly outlining the purpose of the request and the type of information needed. Explanation. This scenario presents a professional challenge due to the inherent conflict between a physician's duty to their patient and the employer's need for information to manage a disability claim. The Certified Disability Management Specialist, CDMS, must navigate this by prioritizing accurate and relevant information while respecting patient confidentiality and legal boundaries. The core of the challenge lies in obtaining necessary medical information for disability determination without overstepping professional or legal lines, which could jeopardize the claim, the patient's trust, or lead to regulatory violations. The correct approach represents best professional practice because it adheres to established ethical guidelines and regulatory frameworks governing disability management and healthcare. Specifically, it emphasizes obtaining explicit, informed consent from the patient for the release of medical information. This aligns with principles of patient autonomy and privacy, as mandated by regulations such as HIPAA in the U.S., which govern the disclosure of protected health information. 5. By directly communicating with the patient and explaining the necessity of specific information for their claim, the CDMS fosters transparency and collaboration, ensuring the patient is an active participant in the process. This also respects the physician's role as the primary source of medical information, ensuring that the information provided is accurate, relevant, and authorized. An incorrect approach that involves the CDMS directly contacting the treating physician to request detailed diagnostic and prognostic information without prior patient consent would constitute a significant ethical and regulatory failure. This action violates patient confidentiality principles and potentially infringes upon privacy laws like HIPAA, which strictly control the disclosure of PHI. Such a breach could lead to legal repercussions, damage the CDMS professional reputation, and erode trust between the patient, employer, and the disability management process. Another incorrect approach, where the CDMS relies solely on the employer's summary of the employee's condition without independent verification of medical facts, is also professionally unacceptable. This bypasses the critical role of medical professionals in assessing disability and could lead to inaccurate claim decisions. It fails to uphold the CDMS responsibility to ensure that disability determinations are based on objective medical evidence, potentially resulting in unfair outcomes for the employee and exposing the employer to risks associated with improper claim management. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the core need. What specific information is required to assess the disability claim? 2. Identify the source of information. Who is the most appropriate and authorized source for this information? Typically the treating physician. 3. Prioritize patient consent. Always seek and obtain explicit, informed consent from the patient before requesting any medical information. Clearly explain what information is needed, why it is needed, and how it will be used. 4. Communicate ethically and legally. If consent is granted, communicate with the physician professionally, clearly stating the purpose of the request and the specific information required. 5. Verify and document. Ensure all information received is accurate, relevant, and properly documented within the claim file. 6. Maintain confidentiality. Uphold strict confidentiality of all patient information throughout the process. 7. Seek clarification. If there are ambiguities or concerns, engage in further communication with the patient or physician to ensure clarity and accuracy. Question 2. Risk assessment procedures indicate that a direct supervisor has requested specific medical details about an employee's condition to better understand their limitations for an upcoming project, bypassing the usual reporting channels that require employee consent for disclosure of non-mandated information. As a certified disability management specialist, CDMS, what is the most appropriate course of action? Option A. Refuse to provide any information to the supervisor, citing confidentiality, without offering any guidance on the proper process. Option B. Provide the supervisor with the requested medical details, as their intention is to support the employee's project involvement. Option C. Report the supervisor's request directly to senior management without first attempting to clarify the reporting process with the supervisor. Option D. Inform the supervisor about the correct reporting procedures, emphasizing the need for employee consent for any information sharing beyond what is legally mandated, and offer to facilitate the process through the proper channels. The correct answer is D. Inform the supervisor about the correct reporting procedures, emphasizing the need for employee consent for any information sharing beyond what is legally mandated, and offer to facilitate the process through the proper channels. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in disability management, where a direct supervisor's request conflicts with established reporting protocols and potentially the employee's privacy rights. The challenge lies in balancing the supervisor's perceived need for information with the CDMS professional obligations to maintain confidentiality and adhere to regulatory reporting requirements. Failure to navigate this correctly can lead to breaches of privacy, non-compliance with reporting mandates, and erosion of trust with both the employee and management. Correct approach analysis. The correct approach prioritizes adherence to the established regulatory framework for reporting. This involves informing the supervisor about the correct reporting channels and the necessity of obtaining employee consent for information sharing beyond what is mandated. This aligns with the CDMS ethical duty to protect employee privacy and comply with all applicable laws and guidelines governing disability management and reporting. Specifically, it upholds the principle of informed consent and ensures that reporting is conducted through authorized and documented processes, preventing unauthorized disclosure of sensitive medical information. Incorrect approaches analysis. One incorrect approach involves directly providing the requested information to the supervisor without verifying the reporting protocol or obtaining employee consent. This constitutes a breach of confidentiality and potentially violates privacy regulations, as medical information is sensitive and its disclosure is strictly controlled. It bypasses established reporting mechanisms, undermining the integrity of the disability management process and creating a risk of legal repercussions. Another incorrect approach is to refuse to provide any information to the supervisor, even about the process, without offering guidance. While maintaining confidentiality is crucial, a complete refusal without explanation or direction can be perceived as uncooperative and may hinder the supervisor's understanding of the process, potentially leading to further attempts to circumvent proper procedures. This fails to educate and guide stakeholders, which is a key function of a CDMS. A third incorrect approach is to bypass the supervisor and report directly to a higher authority without first attempting to clarify the reporting process with the supervisor. While escalation may be necessary in some situations, it should not be the first step when the issue is a misunderstanding of reporting procedures. This can create unnecessary conflict and damage the working relationship with the direct supervisor, and may not be the most efficient or appropriate resolution according to established protocols. Professional reasoning. Professionals should first consult the relevant regulatory framework and internal company policies regarding disability management reporting. If there is ambiguity or a direct conflict, they should seek clarification from their direct supervisor regarding the established reporting channels. If the supervisor's request deviates from policy, the CDMS should politely but firmly explain the correct procedure, emphasizing the need for employee consent for any information sharing beyond mandated reporting and the importance of following established protocols to to ensure compliance and protect privacy. If the supervisor insists on an improper course of action, the CDMS should then consider escalating the issue through appropriate channels, documenting all interactions and decisions. Question 3. Benchmark analysis indicates that a long-term employee with a newly diagnosed chronic autoimmune condition is experiencing increased fatigue and intermittent joint pain, impacting their ability to consistently meet project deadlines. The employer is concerned about project timelines and overall team productivity, which approach best guides the Certified Disability Management Specialist, CDMS, in determining the impact of this disability on work performance and facilitating a resolution. Option A. Rely primarily on the medical diagnosis provided by the employee's physician to determine the extent of their limitations and inform decisions about their capacity to perform their job duties. Option B. Advise the employer that the employee's condition, by its nature, will likely impede their ability to perform essential job functions and suggest exploring alternative roles or termination. Option C. Conduct a thorough job analysis to identify the essential functions of the employee's role. Engage in a collaborative, interactive process with the employee and employer to understand the specific functional limitations caused by the condition, and explore potential reasonable accommodations that could mitigate these limitations and enable successful job performance. Option D. Focus solely on the employer's stated concerns about project timelines and team productivity, and recommend adjustments to the employee's role that minimize any perceived disruption, without a detailed assessment of functional limitations or accommodation options. The correct answer is C. Conduct a thorough job analysis to identify the essential functions of the employee's role. Engage in a collaborative, interactive process with the employee and employer to understand the specific functional limitations caused by the condition, and explore potential reasonable accommodations that could mitigate these limitations and enable successful job performance. Explanation: this scenario is professionally challenging because determining the impact of a disability on work performance requires a nuanced understanding that goes beyond a simple medical diagnosis. It necessitates a comprehensive assessment that considers the individual's specific job duties, the functional limitations imposed by their condition, and the availability and effectiveness of reasonable accommodations. The CDMS professional must navigate the delicate balance between protecting the employee's rights and ensuring the employer's operational needs are met, all while adhering to the Americans with Disabilities Act (ADA) and relevant state laws. The core challenge lies in objectively evaluating how the disability actually affects the ability to perform essential job functions, rather than making assumptions based on the diagnosis alone. The correct approach represents best professional practice because it is grounded in the ADA framework for reasonable accommodation and undue hardship. It involves a collaborative, individualized assessment process that directly engages the employee and employer. This process prioritizes understanding the specific job requirements and the employee's functional limitations. By focusing on the interactive process, exploring potential accommodations, and documenting the rationale for decisions, the CDMS professional upholds ethical obligations and legal compliance. This approach ensures that decisions are evidence-based, fair, and aimed at enabling the employee to perform their job duties effectively, if possible, while respecting the employer's operational realities. An incorrect approach that relies solely on the medical diagnosis without considering the job's essential functions is a regulatory failure. ADA mandates an individualized assessment, not a generalized assumption based on a condition. This approach risks discrimination by failing to explore accommodations that could enable the employee to perform their job. Another incorrect approach that focuses exclusively on the employer's perceived burden without a thorough exploration of reasonable accommodations is also a regulatory and ethical failure. The ADA requires employers to provide reasonable accommodations unless they pose an undue hardship. Simply stating a burden without demonstrating an inability to accommodate is insufficient. This approach can lead to discriminatory outcomes and legal challenges. A third incorrect approach that involves making assumptions about the employee's capabilities based on stereotypes or limited information, without engaging in the interactive process, is a significant ethical and legal misstep. This violates the principle of individualized assessment and can result in unfair treatment and potential legal repercussions under anti-discrimination laws. The professional decision-making process for similar situations should involve 1. Initiating and facilitating the interactive process between the employee and employer. 2. Gathering detailed information about the essential functions of the job. 3. Obtaining relevant medical documentation that clarifies functional limitations, not just diagnoses. 4. Exploring a range of potential reasonable accommodations. 5. Assessing the feasibility and effectiveness of proposed accommodations. And 6. Documenting all steps, discussions, and decisions thoroughly to ensure compliance and a defensible process. Question 4. Which approach would be most appropriate for a Certified Disability Management Specialist, CDMS, to utilize when conducting an initial impact assessment of an individual's functional capacity for return-to-work planning, adhering strictly to U.S. regulatory frameworks and best practices for disability evaluation? Option A. The application of a single, non-standardized questionnaire designed by the treating physician to gauge general well-being, without further objective functional measurement. Option B. A comprehensive evaluation employing standardized, validated functional capacity assessments, validated questionnaires for subjective symptom reporting, and a review of relevant medical documentation, interpreted within the context of the individual's vocational history and job requirements. Option C. An evaluation focused solely on the individual's primary medical diagnosis, without assessing specific functional limitations or work-related capabilities. Option D. An assessment based primarily on the individual's detailed self-reported symptoms and personal narrative, without the inclusion of objective functional testing. Correct answer is B. A comprehensive evaluation employing standardized, validated functional capacity assessments, validated questionnaires for subjective symptom reporting, and a review of relevant medical documentation, interpreted within the context of the individual's vocational history and job requirements. Explanation. Scenario analysis. This scenario presents a common challenge in disability management, balancing the need for objective evaluation with the subjective nature of an individual's experience of disability. The challenge lies in selecting tools that are not only scientifically valid and reliable, but also ethically appropriate and legally compliant within the specific regulatory framework governing Certified Disability Management Specialists, CDMS. The CDMS role requires a nuanced understanding of how different evaluation instruments can impact an individual's access to benefits, return-to-work opportunities, and overall well-being. Misapplication or misinterpretation of these tools can lead to significant adverse outcomes for the individual and potential professional repercussions. Correct approach analysis. The correct approach involves utilizing a comprehensive suite of standardized, validated, and reliable assessment tools that are recognized within the relevant U.S. regulatory framework, e.g., Social Security Administration guidelines, ADA considerations, workers' compensation statutes. This includes functional capacity evaluations, FCE, that objectively measure physical and cognitive abilities relevant to work tasks, as well as validated questionnaires that assess pain, mental health, and quality of life. The selection and application of these tools must be guided by the specific purpose of the evaluation, e.g., determining eligibility for benefits, developing a return-to-work plan, and the individual's reported symptoms and functional limitations. The CDMS must ensure that the chosen instruments are administered by qualified professionals, and that the results are interpreted within the context of the individual's medical history, vocational background, and environmental factors. This holistic and evidence-based approach ensures fairness, accuracy, and compliance with legal and ethical standards, promoting informed decision-making for all parties involved. Incorrect approach is analysis. Relying solely on an individual's self-reported symptoms without objective functional assessment is an ethically and regulatorily flawed approach. While subjective reports are crucial, they must be corroborated by objective findings to ensure fairness and prevent potential fraud or misrepresentation. This approach fails to meet the standards for evidence-based disability evaluation and can lead to inaccurate determinations. Using only generic, non-standardized questionnaires that have not been validated for reliability and validity is also problematic. Such instruments may not accurately capture the individual's functional capacity or may be susceptible to bias. This lack of standardization can lead to inconsistent and unreliable evaluation, violating professional best practices and potentially contravening regulatory requirements for objective assessment. Focusing exclusively on medical diagnoses without considering functional limitations is another incorrect approach. While a diagnosis is important, it does not always directly correlate with an individual's ability to perform work-related activities. Disability management requires an understanding of how a condition impacts function, not just the presence of a diagnosis. This narrow focus can lead to overlooking an individual's residual capacities or overestimating their limitations, resulting in inappropriate benefit decisions or return-to-work plans. Professional reasoning. Professionals in disability management must adopt a systematic and evidence-based approach to evaluation. This involves 1. Clearly defining the purpose of the evaluation. 2. Identifying relevant regulatory and legal frameworks. 3. Selecting appropriate, validated, and reliable assessment tools that address both subjective and objective measures of function. 4. Ensuring proper administration and interpretation of these tools by qualified personnel. And 5. Integrating all gathered information into a comprehensive assessment that considers the individual's unique circumstances. When faced with a scenario requiring disability evaluation, professionals should always prioritize tools and methods that are recognized by relevant U.S. regulatory bodies, and that provide a balanced and objective picture of the individual's functional capacity in relation to their ability to work. Question 5. The review process indicates that claimant reports significant difficulties with concentration and memory, impacting their ability to perform job duties. To better understand these challenges and inform the development of reasonable accommodations, which of the following approaches to psychological assessment is most appropriate and ethically sound within the U.S. regulatory framework for disability management? Option A. Relying on a general personality inventory to gauge the claimant's overall emotional state, assuming that any reported cognitive issues are secondary to underlying psychological distress. Option B. Administering a neuropsychological evaluation by a licensed psychologist to assess specific cognitive functions directly related to the reported concentration and memory deficits, with the results used to identify targeted accommodations. Option C. Utilizing a self-report questionnaire designed for a broad population without specific validation for cognitive impairments, to quickly gather information on the claimant's perceived difficulties. Option D. Requesting a brief informal interview with the claimant's supervisor to gather anecdotal evidence about their concentration and memory issues without involving a qualified assessor. The correct answer is B. Administering a neuropsychological evaluation by a licensed psychologist to assess specific cognitive functions directly related to the reported concentration and memory deficits, with the results used to identify targeted accommodations. Explanation. This scenario presents a professional challenge because the disability management specialist must balance the need for objective medical information with the potential for psychological distress and the legal implications of using assessment data. The specialist must ensure that the chosen psychological assessment is not only relevant to the functional limitations being evaluated, but also administered and interpreted ethically and in accordance with the Certified Disability Management Specialist (CDMS) Code of Ethics and relevant U.S. regulations, such as the Americans with Disabilities Act (ADA) and the Health Insurance Portability and Accountability Act (HIPAA). The specialist's judgment is critical in selecting an assessment that is appropriate for the individual's condition and cultural background, and in ensuring that the results are used solely for the purpose of determining reasonable accommodations and facilitating return to work, without causing undue harm or discrimination. The correct approach represents best professional practice because it prioritizes a comprehensive and individualized assessment that directly addresses the claimant's reported functional limitations and potential barriers to return to work. Utilizing a psychological assessment that is validated for the specific cognitive or emotional challenges relevant to the claimant's condition and administered by a qualified professional ensures the data gathered is reliable and objective. This aligns with the CDMS Code of Ethics, which mandates acting in the best interest of the client while adhering to professional standards and legal requirements. Furthermore, it supports the principles of the ADA by providing a basis for identifying necessary reasonable accommodations. The focus on the assessment's relevance to functional capacity and return-to-work goals ensures that the information is used constructively and ethically. An incorrect approach that relies solely on a generic psychological screening tool without considering its specific relevance to the claimant's reported limitations would be professionally unacceptable. This could lead to misinterpretation of results, potentially misidentifying functional deficits or recommending inappropriate accommodations, thereby failing to meet the claimant's needs and potentially violating ethical obligations to provide effective case management. Another incorrect approach, such as using an assessment tool that has not been validated for the claimant's specific cultural or linguistic background, could introduce bias and lead to inaccurate conclusions, violating principles of fairness and equity. Furthermore, any approach that fails to ensure the confidentiality and proper handling of the psychological assessment data, in accordance with HIPAA, would constitute a significant regulatory and ethical failure. The professional decision-making process for similar situations should involve a systematic evaluation of the claimant's reported limitations, the available medical information, and the specific goals of the disability management plan. The specialist should identify the types of functional capacities that are potentially impacted, and then research and select assessment tools that are evidence-based, validated for the relevant population, and administered by qualified professionals. This process requires careful consideration of the ethical implications of assessment, including informed consent, confidentiality, and the potential for psychological impact on the claimant. Collaboration with healthcare providers and a commitment to ongoing evaluation of the assessment's utility are also crucial components of effective and ethical disability management. Question 6. The analysis reveals a situation where an employee has requested a reasonable accommodation due to a newly diagnosed chronic condition. The employer expresses concern about the potential long-term costs associated with the accommodation and asks the disability management specialist to explore options that minimize financial impact, even if it means delaying the implementation of the employee's preferred accommodation. The specialist has gathered medical documentation supporting the need for accommodation, but is aware that the employee's preferred accommodation is the most effective for their condition. Which communication strategy best upholds the principles of ethical disability management and regulatory compliance within the U.S. framework? Option A. Communicate to the employer that the employee's preferred accommodation is medically necessary and legally required, while also initiating a collaborative discussion with both the employee and employer to explore cost-effective alternatives that still meet the essential needs of the accommodation, ensuring transparency about the process and potential outcomes. Option B. Advise the employer to deny the accommodation request due to the potential long-term financial burden, suggesting the employee seek alternative employment if they cannot perform their current role without the preferred accommodation. Option C. Inform the employer that the employee's preferred accommodation is too costly and suggest a less effective, cheaper alternative that the employer proposed, without fully discussing the medical necessity or potential impact on the employee's ability to perform their job duties. Option D. Proceed with implementing the employer's suggested cost-saving measures without further consultation with the employee, assuming their primary concern is returning to work quickly and that financial considerations are secondary to their immediate needs. The correct answer is A. Communicate to the employer that the employee's preferred accommodation is medically necessary and legally required, while also initiating a collaborative discussion with both the employee and employer to explore cost-effective alternatives that still meet the essential needs of the accommodation, ensuring transparency about the process and potential outcomes. Explanation. This scenario presents a professional challenge due to the inherent conflict between an employer's desire to manage costs and the employee's right to privacy and access to necessary support. The disability management specialist must navigate these competing interests while adhering to the ethical principles and regulatory framework governing their practice, specifically within the context of U.S. disability management laws and professional ethics. The correct approach prioritizes clear, empathetic, and factual communication, ensuring all stakeholders understand the process, their rights, and responsibilities. This aligns with the ethical obligation to act in the best interest of the employee while respecting the employer's legitimate business needs. It also upholds regulatory requirements that mandate fair and transparent processes in disability management. Preventing discrimination and ensuring appropriate accommodations are considered. An incorrect approach that involves withholding information or making assumptions about the employee's condition or capabilities is ethically unsound and potentially violates regulations. Such actions can lead to a breakdown of trust, hinder the employee's return to work, and expose the employer to legal repercussions. Failing to involve the employee in the decision-making process regarding their accommodation plan, or solely relying on the employer's financial concerns without considering the employee's needs, demonstrates a lack of professional integrity and adherence to best practices in disability management. Professionals should employ a decision-making framework that begins with understanding the specific regulatory requirements, e.g., ADA in the U.S., identifying all stakeholders and their perspectives, gathering all relevant factual information, and then developing a communication strategy that is transparent, empathetic, and solution-oriented. This involves active listening, clear articulation of options, and collaborative problem-solving, always with the goal of facilitating a safe and sustainable return to work while respecting all parties' rights and obligations. Question 7. Strategic planning requires a proactive and integrated approach to disability management. When an employee presents with a new medical condition impacting their ability to perform their job duties, which of the following represents the most effective and compliant initial response for a disability management specialist? Option A. Immediately implement a temporary modified work schedule based on the employee's verbal request, pending further medical documentation. Option B. Rely on past experiences with similar conditions to determine the most likely accommodations without direct consultation with the employee or their physician. Option C. Advise the employee to seek external resources for support and inform them that the company cannot accommodate the condition without a formal, lengthy application process. Option D. Initiate a comprehensive assessment process involving the employee, their healthcare provider, and relevant internal stakeholders to identify functional limitations and explore appropriate accommodations. The correct answer is A. Immediately implement a temporary modified work schedule based on the employee's verbal request, pending further medical documentation. Explanation. This scenario is professionally challenging because it requires balancing the immediate needs of an employee with a disability against the long-term sustainability and legal compliance of the employer's disability management program. A robust disability management program, as envisioned by CDMS principles, necessitates proactive, integrated, and evidence-based strategies. The core challenge lies in making decisions that are both compassionate and legally sound, adhering to the principles of reasonable accommodation and non-discrimination, while also managing operational impacts. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment and a collaborative, multi-stakeholder process. This aligns with the CDMS framework's emphasis on early intervention, return-to-work planning, and the use of objective data to inform decisions. By engaging the employee, healthcare providers, and relevant internal departments, the disability management specialist ensures that all relevant factors are considered, leading to a tailored and effective accommodation plan. This approach also proactively addresses potential barriers and facilitates a smoother return to work, minimizing disruption and promoting employee well-being. Adherence to established protocols and documentation ensures compliance with relevant disability management standards and legal requirements. An incorrect approach that focuses solely on the employee's immediate request without a thorough assessment fails to consider the broader implications for the workplace and may not provide the most effective long-term solution. This could lead to an accommodation that is unsustainable or does not fully address the underlying functional limitations. Ethically, it risks setting a precedent that could be difficult to manage consistently across the organization. Another incorrect approach that prioritizes the employer's convenience or cost savings over the employee's documented needs is a direct violation of the principles of reasonable accommodation and non-discrimination. This approach ignores the legal and ethical obligations to provide necessary support and can lead to significant legal repercussions and damage to employee morale and trust. It demonstrates a failure to understand the fundamental purpose of disability management. A third incorrect approach that relies on assumptions or anecdotal evidence rather than objective medical information and functional assessments is professionally unsound. This can lead to inappropriate accommodations, missed opportunities for effective intervention, and potential legal challenges. It undermines the credibility of the disability management program and fails to uphold the professional standards expected of a CDMS. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and validate the employee's concerns. 2. Initiate a prompt and thorough assessment, gathering information from the employee and their healthcare providers. 3. Identify functional limitations and explore potential accommodations in collaboration with the employee. 4. Consult relevant internal policies and legal guidelines. 5. Develop and implement a documented accommodation plan. 6. Monitor the effectiveness of the accommodation and make adjustments as needed. This structured process ensures that decisions are informed, equitable, and compliant. Question 8. The efficiency study reveals that a significant number of clients managed by the Certified Disability Management Specialist, CDMS, are receiving care from multiple physicians and therapists, leading to potential fragmentation of services and conflicting treatment advice. The CDMS is tasked with improving the coordination of care among these various providers to ensure a cohesive and effective return-to-work plan. Which of the following strategies best addresses this implementation challenge? Option A. Facilitate direct communication and information sharing among all treating providers, with client consent, to establish a unified understanding of the client's condition, treatment goals, and return-to-work plan. Option B. Draft and distribute a comprehensive treatment plan to all providers, dictating the specific interventions each should implement based on the CDMS interpretation of their individual reports. Option C. Advise the client to be the sole conduit of information, responsible for relaying all medical updates and treatment recommendations between their various healthcare providers. Option D. Rely solely on communication with the client's primary care physician, assuming their oversight is sufficient to manage the plans of other specialists. The correct answer is A. Facilitate direct communication and information sharing among all treating providers, with client consent, to establish a unified understanding of the client's condition, treatment goals, and return-to-work plan. Explanation. Scenario analysis. This scenario presents a common challenge in disability management, where a client receives care from multiple independent providers, each with their own treatment plans and communication styles. The professional challenge lies in synthesizing disparate information, ensuring continuity of care, and preventing conflicting advice or redundant services, all while respecting patient privacy and provider autonomy. This requires strong interpersonal skills, meticulous record-keeping, and a deep understanding of the client's overall functional capacity and return-to-work goals. Correct approach analysis. The correct approach prioritizes establishing a unified communication channel and a shared understanding of the client's goals among all involved parties. This aligns with best practices in case management and the ethical imperative to act in the client's best interest. By facilitating direct communication between providers, the disability management specialist can identify potential conflicts, streamline treatment, and ensure that all interventions are coordinated towards a common objective of safe and timely return to work. This proactive coordination is essential for effective disability management and is implicitly supported by the principles of comprehensive care planning, often found in professional guidelines for CDMS. Incorrect approaches analysis. One incorrect approach involves solely relying on the client to relay information between providers. This is a significant failure because it places an undue burden on the client, who may be experiencing cognitive or physical limitations affecting their ability to accurately communicate complex medical information. It also increases the risk of misinterpretation, omission of critical details, and delays in care, potentially violating the duty of care owed to the client. Another incorrect approach is to only communicate with the primary treating physician and assume other specialists' plans are aligned. This is problematic, as it ignores the potential for specialized treatments or recommendations from other providers that may impact the overall recovery trajectory or return-to-work capacity. Failing to engage all relevant providers can lead to fragmented care and suboptimal outcomes, contravening the principles of holistic case management. A third incorrect approach is to dictate treatment plans to providers based on the specialist's interpretation of their reports. This oversteps professional boundaries and undermines the expertise of the treating physicians. While the disability management specialist synthesizes information, they are not authorized to prescribe medical treatment. This approach risks alienating providers, creating adversarial relationships, and potentially leading to inappropriate or ineffective care plans, which is ethically and professionally unsound. Professional reasoning. Professionals should adopt a collaborative and facilitative approach. The decision-making process involves 1. Identifying all involved providers and understanding their roles. 2. Obtaining client consent to communicate with providers. 3. Initiating communication with all providers to establish a baseline understanding of the client's condition and treatment plans. 4. Facilitating a coordinated care plan that addresses all aspects of the client's recovery and return-to-work potential. 5. Regularly reviewing and updating the plan based on ongoing provider and client feedback. This systematic process ensures comprehensive, client-centered care. Question 9. During the evaluation of return-to-work initiatives, which approach most effectively measures their success by considering the sustained functional capacity of the employee post-return, their satisfaction with the process, and the overall impact on their long-term employability within the organization. Option A. Analyzing the percentage of employees who return to their pre-injury roles within a specified time frame, irrespective of their ongoing functional limitations or job satisfaction. Option B. Reviewing the number of modified duty assignments offered and accepted, without tracking the long-term outcomes for those employees or their progression back to full duties. Option C. Assessing the duration of sustained employment post-return, the employee's reported ability to perform essential job functions without undue hardship, and their feedback on the support received. Option D. Focusing primarily on the reduction in workers' compensation, claims costs, and the speed at which employees are cleared to return to work, without assessing the quality of the return. The correct answer is A. Analyzing the percentage of employees who return to their pre-injury roles within a specified time frame, irrespective of their ongoing functional limitations or job satisfaction. Explanation. This scenario is professionally challenging because evaluating the effectiveness of return-to-work (RTW) initiatives requires a nuanced understanding of both quantitative and qualitative data, and the ability to discern which metrics truly reflect successful outcomes beyond mere statistical reporting. The CDMS professional must navigate the complexities of individual employee circumstances, employer policies, and the overarching regulatory landscape to make informed judgments. Careful judgment is required to avoid superficial assessment that might overlook systemic issues or individual needs. The correct approach represents best professional practice because it employs a balanced methodology that considers both the impact on the individual employee and the broader organizational goals. By focusing on objective measures of functional improvement, sustained employment, and employee satisfaction, it aligns with the ethical imperative to promote well-being and facilitate a safe, productive return to work. This approach also implicitly supports compliance with regulations that mandate fair and effective RTW processes, ensuring that initiatives are not just implemented, but are demonstrably beneficial. An incorrect approach that relies solely on the number of employees who return to work without considering the duration of their return or their functional capacity fails to meet professional standards. This is because it ignores the qualitative aspects of RTW, such as whether the employee is performing their duties effectively and without undue strain, which is crucial for long-term success and preventing re-injury. Such an approach could lead to a false sense of accomplishment while masking underlying problems. Another incorrect approach that focuses exclusively on employer cost savings without assessing employee outcomes is ethically problematic. While cost-effectiveness is a consideration, prioritizing it over the employee's health, safety, and ability to perform their job duties violates the core principles of disability management. This approach risks creating an environment where employees are pressured to return before they are ready, potentially leading to negative health consequences and increased long-term costs. A third incorrect approach that solely examines the speed of return to work without considering the appropriateness of the assigned duties or the availability of necessary accommodations overlooks critical factors for sustainable RTW. A quick return to an unsuitable role or without proper support is unlikely to be effective and can lead to dissatisfaction and further absence. This approach fails to demonstrate a comprehensive understanding of the multifaceted nature of successful RTW. The professional decision-making process for similar situations should involve a systematic review of all available data, including employee feedback, medical reports, employer records, and the specific objectives of the RTW initiative. Professionals should prioritize a holistic view that balances the needs of the employee with the operational requirements of the employer, always guided by ethical principles and regulatory compliance. This involves asking critical questions about the quality of the return, the sustainability of the outcome, and the overall impact on the individual's well-being and the organization's productivity. Question 10. Cost-benefit analysis shows that a proactive, integrated approach to disability management, which includes early intervention, individualized accommodation planning, and a focus on return to work, yields greater long-term organizational and employee benefits than a reactive approach solely focused on claim duration and payout. Considering the historical evolution of disability management in the United States, which of the following stakeholder perspectives best reflects the principles that have shaped modern, effective disability management practices? Option A. The perspective that emphasizes early identification of barriers to return to work and collaborative development of tailored solutions, recognizing that sustained employee engagement and productivity are paramount. Option B. The perspective that prioritizes minimizing immediate financial expenditures by strictly adhering to predefined benefit timelines and limiting employer involvement in return-to-work efforts. Option C. The perspective that views disability solely as a medical issue requiring passive management of benefits until maximum medical improvement is reached, with minimal employer responsibility for accommodation. Option D. The perspective that focuses on the administrative efficiency of processing claims according to established protocols, with limited consideration for the individual employee's unique circumstances or the broader impact on organizational culture. The correct answer is A. The perspective that emphasizes early identification of barriers to return to work and collaborative development of tailored solutions, recognizing that sustained employee engagement and productivity are paramount. Explanation. This scenario presents a professional challenge because it requires a disability management specialist to balance the immediate financial implications of a disability claim with the long-term, often intangible, benefits of effective disability management, all within the evolving regulatory landscape of the United States. The historical context of disability management, moving from a purely medical or compensation-focused model to a proactive, return-to-work orientation, is crucial for understanding the underlying principles that guide current best practices. A specialist must navigate the tension between short-term cost containment and the broader organizational and individual benefits of supporting an employee's return to work. The correct approach represents best professional practice because it acknowledges the historical shift in disability management philosophy. Early approaches often focused on simply managing the financial payout of a claim. However, the evolution of the field, influenced by legislation like the Americans with Disabilities Act (ADA) and the principles of vocational rehabilitation, emphasizes early intervention, accommodation, and a focus on an individual's remaining abilities. This approach aligns with the CDMS certification's core competencies, which include understanding the psychosocial, vocational, and economic aspects of disability. It recognizes that a comprehensive, integrated approach, considering the employee's well-being and the employer's operational needs, leads to better outcomes for all stakeholders, including reduced long-term costs associated with prolonged absence, turnover, and potential litigation. This aligns with the spirit of federal regulations that encourage accommodation and return to work. An incorrect approach that solely focuses on minimizing immediate claim costs by denying or delaying necessary accommodations or return-to-work support would be professionally unacceptable. This failure stems from a misunderstanding of the historical evolution of disability management and a disregard for the spirit and intent of U.S. disability law, such as the ADA, which mandates reasonable accommodations. Such an approach could lead to ethical breaches by not acting in the best interest of the employee and could result in legal repercussions for the employer due to noncompliance. Another incorrect approach that prioritizes a rigid, one-size-fits-all return-to-work plan without considering the individual's specific needs and limitations would also be flawed. This ignores the individualized nature of disability management and the importance of tailoring interventions, a key lesson learned from the historical development of the field. Ethically, this fails to uphold the principle of individualized assessment and support. The professional decision-making process for similar situations should involve a thorough assessment of the individual's condition, functional limitations, and the essential functions of their job. It requires understanding the historical context of disability management to appreciate the shift towards proactive, supportive interventions. Professionals should consult relevant U.S. federal and state regulations, including the ADA and its amendments, as well as workers' compensation laws. They should engage in open communication with the employee, healthcare providers, and the employer to develop a collaborative and individualized return-to-work plan. This process emphasizes evidence-based practices and a commitment to ethical principles, ensuring that decisions are made in the best interest of the employee, while also considering the employer's operational realities and legal obligations. Question 11. System analysis indicates that a Certified Disability Management Specialist, CDMS, is tasked with evaluating an individual's eligibility for disability benefits. The individual has provided medical reports from their treating physician detailing a chronic condition and its potential impact. However, the employer has raised concerns about the individual's ability to perform the essential functions of their role. Citing observations of limited physical capacity, the CDMS must determine the most appropriate method to comprehensively assess the individual's disability status, ensuring compliance with relevant U.S. disability management regulations and ethical standards. Which of the following approaches best addresses this implementation challenge? Option A. Rely solely on the treating physician's subjective assessment of the individual's limitations as documented in their medical reports. Option B. Base the disability determination primarily on the individual's job description and their stated ability to perform those duties. Option C. Conduct a comprehensive functional capacity evaluation, FCE, to objectively measure the individual's physical and cognitive abilities in relation to their job demands, in conjunction with a thorough review of all provided medical documentation. Option D. Prioritize the employer's observations and concerns regarding the individual's physical capacity without further objective assessment. The correct answer is C. Conduct a comprehensive functional capacity evaluation, FCE, to objectively measure the individual's physical and cognitive abilities in relation to their job demands, in conjunction with a thorough review of all provided medical documentation. Explanation. Scenario analysis. This scenario presents a common implementation challenge in disability management, reconciling potentially conflicting information from different assessment methods to arrive at an accurate and defensible disability determination. The challenge lies in the inherent subjectivity of some assessments and the need to ensure that the chosen method aligns with the specific requirements of the Certified Disability Management Specialist, CDMS certification, and its governing regulatory framework, which in this context is assumed to be U.S.-based federal and state regulations pertaining to disability claims and workers' compensation. The professional must navigate the nuances of medical evidence versus functional capacity, ensuring that the assessment process is comprehensive, objective, and ethically sound, while also being compliant with relevant laws and guidelines. Correct approach analysis. The correct approach involves a multifaceted assessment strategy that integrates medical evaluations with functional capacity evaluations, FCE. This aligns with best professional practice for CDMS professionals because it provides a holistic view of the individual's disability. Medical evaluations establish the underlying pathology and prognosis, while FCEs objectively measure the individual's current physical and cognitive abilities in relation to work demands. This combination ensures that the disability determination is based on both the medical condition and its actual impact on the individual's ability to perform essential job functions, as required by regulations like the Americans with Disabilities Act (ADA) and various state workers' compensation laws. The CDMS Code of Ethics also emphasizes a thorough and objective evaluation process. Incorrect approach is analysis. Relying solely on a physician's subjective opinion without objective functional testing is an incomplete approach. While medical opinions are crucial, they may not always translate directly into an individual's capacity to perform specific job tasks. This can lead to inaccurate determinations and potential legal challenges under ADA or workers' compensation statutes, which often require evidence of functional limitations. Using only self-reported functional limitations without corroborating medical or objective functional assessments is also problematic. Self-reporting, while valuable for understanding the individual's experience, can be subjective and may not accurately reflect the extent of disability or its underlying cause. This approach lacks the objective evidence required by many disability frameworks and can be challenged for its lack of rigor. Focusing exclusively on an individual's job description without considering their current medical status or functional capacity is another flawed approach. A job description outlines the theoretical requirements of a role, but it does not account for the impact of a disability on an individual's ability to meet those requirements. This method fails to address the core purpose of disability management, which is to assess the individual's current capabilities in relation to their work. Professional reasoning. Professionals should adopt a systematic approach that begins with understanding the specific regulatory framework governing the claim. This involves identifying the types of evidence required for disability determination. The process should then involve gathering all relevant medical documentation. Subsequently, a functional capacity evaluation should be conducted to objectively assess the individual's abilities. The CDMS professional's role is to synthesize this information, identify discrepancies, and make a determination that is supported by both medical and functional evidence, adhering to ethical principles of fairness and objectivity, and complying with all applicable laws and regulations. Question 12. Regulatory review indicates that an employee with a diagnosed chronic fatigue condition has requested a modified work schedule, including the ability to work remotely 2 days a week, to manage their energy levels and attend necessary medical appointments. The employer's initial assessment suggests this arrangement would disrupt team collaboration and require significant IT infrastructure adjustments for remote access. What is the most appropriate course of action for the disability management specialist to advise the employer? Option A. Approve the remote work arrangement as requested without further discussion, assuming the employee's medical condition necessitates it, to avoid potential legal repercussions. Option B. Initiate a formal interactive process with the employee to explore the feasibility and effectiveness of the requested remote work arrangement, investigate potential IT solutions and alternative remote work policies, and assess if the proposed accommodation would impose an undue hardship on the employer. Option C. Inform the employee that the requested remote work arrangement is not feasible due to the potential disruption to team collaboration and the cost of IT adjustments, and suggest they explore other options outside of the company. Option D. Advise the employer to offer a less flexible accommodation, such as allowing the employee to take unpaid leave whenever they experience fatigue, without exploring the employee's specific request for remote work. Correct answer is B. Initiate a formal interactive process with the employee to explore the feasibility and effectiveness of the requested remote work arrangement, investigate potential IT solutions and alternative remote work policies, and assess if the proposed accommodation would impose an undue hardship on the employer. Explanation. This scenario presents a common challenge in disability management, balancing an employer's operational needs with an employee's right to reasonable accommodation under the Americans with Disabilities Act, ADA. The professional challenge lies in interpreting the scope of reasonable and effective accommodation and understanding the employer's obligation to engage in an interactive process. Careful judgment is required to avoid both undue hardship for the employer and discrimination against the employee. The correct approach involves a thorough interactive process, exploring all potential accommodations that would enable the employee to perform the essential functions of their job without causing undue hardship to the employer. This aligns with the ADA mandate for employers to provide reasonable accommodations, unless doing so would impose an undue hardship. The employer must demonstrate a good faith effort to engage with the employee, consider their proposed accommodations, and explore alternative solutions. This collaborative approach is the cornerstone of effective disability management and legal compliance. An incorrect approach would be to unilaterally deny the employee's requested accommodation based solely on the employer's initial assessment of inconvenience or cost, without engaging in the interactive process. This fails to meet the ADA requirement for a good faith dialogue and exploration of alternatives. Another incorrect approach is to offer an accommodation that is not effective in enabling the employee to perform essential job functions, even if it seems like a reasonable gesture. This also violates the spirit and letter of the ADA, which requires accommodations to be effective. Finally, assuming the employee is not qualified for any accommodation without a thorough assessment of their limitations and potential solutions is a significant regulatory and ethical failure, as it presumes inability rather than exploring possibility. Professionals should approach such situations by first understanding the employee's limitations and the essential functions of the job. Then, they should initiate a structured interactive process, documenting all communications and considerations. This process should involve exploring the employee's proposed accommodation, researching alternative accommodations, assessing the feasibility and effectiveness of each, and considering potential undue hardship. The decision should be based on a comprehensive evaluation of all factors, prioritizing solutions that enable the employee to perform their job while minimizing disruption to the employer. Question 13. Process analysis reveals a certified disability management specialist is evaluating an employee who reports significant pain and inability to perform their job duties following a non-work-related injury. The employee's primary care physician has provided a note stating the employee is under their care for pain, but has not specified functional limitations or a return-to-work prognosis. The employer is concerned about the employee's prolonged absence and potential impact on productivity. Which of the following approaches best guides the specialist's assessment and evaluation of this disability? Option A. Conclude that since the injury is non-work-related and the medical documentation is minimal, the employee is not currently disabled and should be advised to seek further medical treatment independently without further involvement from the disability management specialist. Option B. Initiate a comprehensive assessment including obtaining detailed medical reports from all treating providers, conducting a functional capacity evaluation to objectively measure physical and cognitive abilities, and engaging in an interactive process with the employee and employer to understand job demands and explore potential accommodations. Option C. Accept the employer's assessment of the employee's capabilities and focus on finding tasks within the employer's perceived capacity for the employee, without independent medical or functional evaluation. Option D. Rely primarily on the employee's subjective report of pain and the limited physician's note to determine the extent of disability and recommend immediate work restrictions until the employee fully recovers. The correct answer is B. Initiate a comprehensive assessment including obtaining detailed medical reports from all treating providers, conducting a functional capacity evaluation to objectively measure physical and cognitive abilities, and engaging in an interactive process with the employee and employer to understand job demands and explore potential accommodations. Explanation. This scenario presents a professional challenge because the disability management specialist must balance the individual's subjective experience of pain and functional limitation with objective medical findings and the requirements of the Americans with Disabilities Act (ADA) and relevant state workers' compensation laws. The specialist needs to conduct a thorough assessment that considers all relevant factors without prematurely concluding the extent of disability or the need for specific accommodations. The challenge lies in synthesizing diverse information into a coherent evaluation that supports informed decision-making for return-to-work planning. The correct approach represents best professional practice because it adheres to the principles of comprehensive disability assessment as outlined by the CDMS framework, which emphasizes a holistic view. This involves gathering information from multiple sources, including the employee, healthcare providers, and employer, and considering functional capacity, medical limitations, and the essential functions of the job. This approach aligns with the ADA requirement to engage in an interactive process to determine reasonable accommodations, and with workers' compensation principles that require an accurate assessment of disability to ensure appropriate benefits and support for recovery. It prioritizes evidence-based evaluation and collaborative problem-solving. An incorrect approach that focuses solely on the employee's reported pain without corroborating medical evidence or functional capacity assessments fails to meet the objective standards required for disability determination under the ADA and workers' compensation. This can lead to an overestimation of disability and unnecessary work restrictions, potentially hindering return-to-work efforts. Ethically, it may also lead to the provision of inappropriate benefits or accommodations. Another incorrect approach that relies exclusively on the employer's perception of the employee's ability to perform tasks, without a thorough independent assessment of the employee's functional limitations and medical restrictions, risks overlooking genuine disabilities. This can violate the ADA mandate for an interactive process and may lead to discrimination or failure to provide necessary accommodations. It also fails to uphold the principles of fair and accurate disability evaluation. A third incorrect approach that prematurely determines the employee is not disabled based on a limited review of medical records, without engaging in a comprehensive assessment or the interactive process is also professionally unacceptable. This can lead to a denial of legitimate claims, a failure to provide required accommodations, and potential legal repercussions under the ADA and state laws. It bypasses the critical steps necessary for a fair and accurate disability evaluation. The professional decision-making process for similar situations should involve a systematic approach. 1. Initiate the interactive process promptly. 2. Gather comprehensive information from all relevant parties, employee, treating physicians, employer. 3. Conduct a functional capacity evaluation if necessary to objectively assess limitations. 4. Review medical documentation to understand diagnoses, prognoses, and treatment plans. 5. Analyze the essential functions of the employee's job. 6. Synthesize all gathered information to determine the nature and extent of the disability and identify potential reasonable accommodations. 7. Document all steps and findings thoroughly. 8. Collaborate with the employee and employer to develop and implement a return-to-work plan. Question 14. The assessment process reveals an employee experiencing significant limitations in performing their essential job functions due to a diagnosed chronic condition. The employee expresses distress about their ability to meet performance expectations and has noted a lack of support from their immediate supervisor. Which approach to disability management best aligns with regulatory requirements and ethical best practices for a certified disability management specialist in the U.S.? Option A. Prioritizing a comprehensive evaluation that considers the medical diagnosis, the employee's psychological well-being, and the social and environmental factors impacting their work performance and ability to return to duty. Option B. Focusing exclusively on the medical diagnosis and its direct physical limitations, recommending accommodations solely based on these findings. Option C. Relying primarily on the employee's self-reported ability to perform tasks without a thorough assessment of the underlying medical or psychological factors. Option D. Emphasizing the identification and removal of societal barriers within the workplace, assuming that addressing these will resolve the employee's functional limitations. The correct answer is A. Prioritizing a comprehensive evaluation that considers the medical diagnosis, the employee's psychological well-being, and the social and environmental factors impacting their work performance and ability to return to duty. Explanation. This scenario presents a common challenge in disability management, balancing the individual's experience of disability with the functional demands of their role, all within the framework of applicable U.S. regulations and CDMS ethical guidelines. The professional must move beyond a singular perspective to adopt a holistic approach that considers all contributing factors. The correct approach, rooted in the biopsychosocial model, represents best professional practice because it aligns with the comprehensive understanding of disability mandated by regulations like the Americans with Disabilities Act (ADA) and supported by CDMS certification standards. ADA requires employers to provide reasonable accommodations that address the impact of a disability on an individual's ability to perform essential job functions. The biopsychosocial model, by integrating medical, psychological, and social factors, provides the most thorough basis for identifying appropriate accommodations. It acknowledges that disability is not solely a medical condition, but is influenced by an individual's environment, personal beliefs, and social support systems. This comprehensive view allows for the identification of a wider range of effective accommodations, promoting return to work and sustained employment. An approach solely focused on the medical model would be professionally unacceptable because it risks overlooking crucial psychosocial factors that may impede return to work or necessitate specific accommodations. For instance, it might fail to address anxiety related to job performance or the impact of workplace culture on an individual's well-being. This narrow focus could lead to inadequate accommodations and potential violations of the ADA requirement to provide effective accommodations. An approach solely focused on the social model would also be professionally unacceptable. While it rightly emphasizes societal barriers and the need for environmental adjustments, it might underestimate the direct impact of a medical condition on an individual's functional capacity. Without considering the medical aspects, accommodations might be insufficient to address the core limitations imposed by the disability, potentially leading to a failure to perform essential job functions and a less effective return-to-work outcome. The professional decision-making process for similar situations should involve a systematic evaluation of the individual's condition from multiple perspectives. This includes gathering information about the medical diagnosis and its functional implications, understanding the individual's psychological state and coping mechanisms, and assessing the social and environmental context of their work. The goal is to synthesize this information to identify barriers and develop a plan for reasonable accommodations that addresses the interplay of these factors, ensuring compliance with legal requirements and promoting the individual's successful return to and maintenance of employment. Question 15. Implementation of a return-to-work strategy for an employee with a diagnosed chronic condition requires careful consideration of medical restrictions, job duties, and legal obligations. The employee has provided a doctor's note outlining specific physical limitations. The employer is concerned about the employee's ability to perform essential job functions and potential safety risks. Which of the following approaches best navigates this situation according to U.S. disability management principles and the Americans with Disabilities Act (ADA)? Option A. Immediately deny the employee's request to return to work, citing the doctor's note and the employer's concerns about operational efficiency and potential safety hazards, without further discussion or exploration of alternatives. Option B. Implement a temporary, less demanding role for the employee without a formal assessment of the essential functions of their original position or exploring accommodations for their current role, assuming this will suffice until the employee's condition improves. Option C. Rely solely on the employee's self-assessment of their capabilities and the doctor's note, without independently verifying the feasibility of accommodations or assessing the essential functions of the job to determine if a return to work is possible. Option D. Initiate a formal interactive process with the employee and employer to thoroughly assess the medical restrictions, the essential functions of the employee's position, and to collaboratively explore potential reasonable accommodations that would enable the employee to perform their job duties safely and effectively. The correct answer is D. Initiate a formal interactive process with the employee and employer to thoroughly assess the medical restrictions, the essential functions of the employee's position, and to collaboratively explore potential reasonable accommodations that would enable the employee to perform their job duties safely and effectively. Explanation. This scenario presents a common challenge in disability management, balancing an employee's desire to return to work with medical limitations and employer operational needs, all within the framework of the Americans with Disabilities Act (ADA) and relevant state laws. The professional challenge lies in navigating the interactive process effectively, ensuring reasonable accommodations are considered without compromising safety or essential job functions, and documenting all steps meticulously. The correct approach prioritizes a collaborative, evidence-based strategy. It involves a thorough review of medical documentation, a clear understanding of the employee's functional limitations, and a detailed analysis of the essential functions of the job. Crucially, it emphasizes engaging in the interactive process with both the employee and the employer to identify potential reasonable accommodations that enable the employee to perform their essential job functions. This aligns with the ADA mandate to provide reasonable accommodations, unless doing so would impose an undue hardship on the employer. Ethical practice dictates a focus on the individual's capabilities and rights while respecting the employer's operational realities. An incorrect approach that focuses solely on the employer's immediate operational convenience without a genuine attempt to explore accommodations fails to meet ADA requirements. This could lead to allegations of discrimination. Another incorrect approach that relies solely on the employee's subjective request without objective medical or functional assessment risks making decisions that are not sustainable or safe, potentially leading to further injury or inability to perform the job. An approach that prematurely concludes return to work is impossible without exploring all reasonable accommodation options, also violates the spirit and letter of the ADA, which mandates an interactive process to find solutions. Professional decision-making in such situations requires a systematic approach. First, gather all relevant information, medical, functional, job requirements. Second, engage in open and honest communication with all parties involved. Third, explore all potential reasonable accommodations, considering their effectiveness and feasibility. Fourth, document every step of the process, including discussions, assessments, and decisions. And finally, consult with legal counsel or HR if complex legal or ethical issues arise. Question 16. Operational review demonstrates that a disability management program is primarily focused on processing medical documentation for approved absences and coordinating benefit payments. This approach largely overlooks proactive measures for preventing disability, facilitating early intervention for employees experiencing health challenges, and implementing accommodations to support ongoing work. Considering the regulatory framework and professional standards for Certified Disability Management Specialists, CDMS, which of the following best defines the scope of disability management in this context? Option A. Disability management is limited to the administrative processing of disability claims and the disbursement of benefits to eligible individuals. Option B. Disability management encompasses a broad spectrum of activities aimed at preventing disability, facilitating early intervention, managing existing disabilities, and promoting the health and productivity of all employees. Option C. Disability management focuses exclusively on the medical assessment and treatment of individuals with diagnosed disabilities to determine their eligibility for benefits. Option D. Disability management involves only the legal compliance aspects of disability, ensuring adherence to all relevant statutes and regulations regarding employee absences. The correct answer is B. Disability management encompasses a broad spectrum of activities aimed at preventing disability, facilitating early intervention, managing existing disabilities, and promoting the health and productivity of all employees. Explanation: this scenario presents a professional challenge because it requires a nuanced understanding of the definition and scope of disability management within the specific regulatory framework governing the Certified Disability Management Specialist (CDMS) exam. The challenge lies in distinguishing between a broad, holistic approach to disability management that encompasses proactive and preventative measures, and a narrower, reactive approach focused solely on managing existing impairments. Accurate application of the CDMS relevant regulatory framework is paramount to ensure compliance and effective service delivery. The correct approach represents best professional practice because it aligns with the comprehensive definition of disability management as outlined by relevant U.S. federal and state regulations and professional guidelines that the CDMS certification adheres to. This definition typically includes not only the management of existing disabilities, but also the prevention of disability, accommodation of employees with disabilities, and the promotion of overall workplace health and safety. This holistic perspective ensures that disability management specialists are equipped to address the multifaceted nature of disability in the workplace, fostering a supportive environment and maximizing employee productivity and well-being. It reflects a proactive stance that can reduce the incidence and duration of disability, benefiting both the employee and the employer. An incorrect approach that focuses solely on the reactive management of diagnosed impairments fails to encompass the full scope of disability management as understood within the CDMS framework. This narrow view neglects the crucial elements of prevention, early intervention, and proactive accommodation, which are integral to a comprehensive disability management program. Ethically, this approach could lead to missed opportunities to prevent disability or to support employees before their condition significantly impacts their work. Regulatory failure would occur if this limited scope resulted in noncompliance with laws such as the Americans with Disabilities Act (ADA), or state-specific workers' compensation, or disability benefit laws, which mandate proactive measures and reasonable accommodations. Another incorrect approach that prioritizes only the administrative processing of claims, without considering the individual's functional capacity or the employer's role in accommodation, also falls short. This approach is purely transactional and overlooks the rehabilitative and supportive aspects of disability management. It may lead to inefficient claim resolution, prolonged absences, and a failure to return employees to work in a timely and sustainable manner. This approach is ethically questionable as it may not adequately serve the best interests of the individual with a disability. Regulatory failure could arise from noncompliance with return-to-work provisions or accommodation requirements embedded in various disability-related statutes. A professional decision-making process for similar situations should begin with a thorough understanding of the applicable regulatory framework, including federal laws like the ADA, FMLA, and relevant state workers' compensation and disability insurance laws. This should be followed by an assessment of the specific organizational context and the needs of the individual employee. The specialist must then integrate these elements to develop and implement a comprehensive disability management strategy that is both compliant and effective, encompassing prevention, intervention, accommodation, and return-to-work planning. Continuous professional development and adherence to ethical guidelines are essential to navigate the complexities of disability management. Question 17. Market research demonstrates that many organizations struggle to move beyond the initial implementation of workplace accommodations. A disability management specialist is tasked with evaluating the success of a recently implemented ergonomic workstation for an employee with a back condition. The employee has verbally expressed satisfaction with the new setup. What is the most effective approach to assessing the accommodation's effectiveness? Option A. Assume the accommodation is effective based on the employee's positive verbal feedback and close the case file. Option B. Focus primarily on the cost savings achieved by the new workstation compared to the employee's previous setup. Option C. Discontinue monitoring the accommodation's effectiveness after 1 month, as it is assumed that the employee has fully adjusted. Option D. Conduct a follow-up meeting with the employee and their direct supervisor to review objective performance metrics against pre-accommodation benchmarks and discuss any ongoing challenges or needs. The correct answer is D. Conduct a follow-up meeting with the employee and their direct supervisor to review objective performance metrics against pre-accommodation benchmarks and discuss any ongoing challenges or needs. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a disability management specialist to move beyond simply implementing an accommodation to actively evaluating its success. The challenge lies in objectively measuring effectiveness, which can be influenced by subjective employee perceptions, evolving job demands, and the limitations of the initial assessment. A failure to rigorously assess effectiveness can lead to continued underperformance, employee dissatisfaction, and potential legal or regulatory noncompliance if the accommodation is deemed inadequate or no longer effective. Correct approach analysis. The correct approach represents best professional practice because it aligns with the principles of ongoing case management and the Americans with Disabilities Act (ADA), as interpreted by the Equal Employment Opportunity Commission (EOC) guidelines. The ADA mandates a reasonable accommodation process that is interactive and iterative. This means that once an accommodation is implemented, its effectiveness must be monitored and adjusted as needed. Focusing on objective performance metrics, employee feedback, and a review of the original job functions ensures that the accommodation is truly enabling the employee to perform the essential functions of the job. This proactive evaluation is crucial for demonstrating good faith in the accommodation process and for ensuring the employee's continued success and inclusion in the workplace. Incorrect approaches analysis. One incorrect approach involves assuming the accommodation is effective solely based on the employee's initial positive verbal feedback. This is professionally unacceptable because it bypasses the critical step of objective verification. While employee feedback is important, it is subjective and may not fully capture the impact on job performance or identify subtle challenges. Relying solely on this can lead to a failure to identify if the accommodation is truly enabling the employee to meet performance standards, potentially violating the spirit of the ADA requirement for effective accommodations. Another incorrect approach is to discontinue monitoring after a short period, assuming the accommodation has stabilized. This is a regulatory and ethical failure because the effectiveness of an accommodation can change over time due to evolving job duties, changes in the employee's condition, or environmental factors. The ADA implies an ongoing responsibility to ensure accommodations remain effective. Ceasing evaluation prematurely risks the accommodation becoming obsolete or insufficient, leading to a breakdown in the employee's ability to perform essential functions and potential discrimination claims. A third incorrect approach is to focus solely on the cost of the accommodation rather than its impact on performance. While cost is a factor in determining reasonableness, it should not be the primary metric for effectiveness. The ADA prioritizes enabling the employee to perform essential job functions. An accommodation, regardless of cost, is ineffective if it does not achieve this outcome. Prioritizing cost over performance can lead to the selection of accommodations that are insufficient, thereby failing to meet the legal and ethical obligations of providing effective support. Professional reasoning. Professionals should adopt a systematic, data-driven approach to assessing accommodation effectiveness. This involves establishing clear, measurable performance indicators before or during the accommodation implementation. Regular check-ins, both formal and informal, should be scheduled. These should include opportunities for the employee to provide feedback, but also for the manager and the disability management specialist to observe performance and gather objective data. If performance metrics are not being met, or if new challenges arise, the interactive process should be reinitiated to explore modifications or alternative accommodations. This iterative process ensures compliance with legal mandates and promotes the long-term success of the employee and the organization. Question 18. The risk matrix shows a moderate likelihood of a productivity impact if an employee with a diagnosed chronic fatigue condition is not provided with a modified work schedule. The employee has requested a compressed work week, working 4 10-hour days instead of 5 8-hour days, to allow for rest days. The employer is concerned about coverage on the 5th day and potential burnout from longer workdays. Which of the following represents the most appropriate initial step in addressing this accommodation request? Option A. Suggest the employee take a leave of absence until their condition improves, as a modified schedule might not be feasible for the business. Option B. Immediately approve the compressed work week as requested by the employee to avoid potential legal repercussions, without further discussion or assessment. Option C. Deny the request for a compressed work week due to concerns about coverage on the 5th day and potential employee burnout, and inform the employee that no modifications can be made. Option D. Initiate a formal interactive process with the employee to explore the feasibility of the compressed work week, discuss potential alternative accommodations, and assess the impact on essential job functions and business operations. The correct answer is D. Initiate a formal interactive process with the employee to explore the feasibility of the compressed work week, discuss potential alternative accommodations, and assess the impact on essential job functions and business operations. Explanation. This scenario presents a common challenge in disability management, balancing an employee's need for accommodation with the operational realities of the workplace. The professional challenge lies in identifying accommodations that are effective, reasonable, and compliant with the Americans with Disabilities Act (ADA), as interpreted by relevant federal guidance and case law. Careful judgment is required to avoid discrimination while ensuring business needs are met. The correct approach represents best professional practice because it prioritizes a collaborative, individualized assessment process. This aligns with the ADA mandate for an interactive process to identify reasonable accommodations. It involves understanding the specific limitations of the employee, the essential functions of the job, and exploring a range of potential accommodations. This approach is ethically sound and legally defensible, as it demonstrates a good faith effort to accommodate the employee's disability. An incorrect approach that focuses solely on the employee's request without considering feasibility or essential job functions fails to engage in the interactive process and could lead to an unreasonable accommodation, potentially violating the ADA. Another incorrect approach that dismisses the request outright without exploring alternatives or engaging in dialogue constitutes a failure to accommodate and could be considered discriminatory. An approach that imposes a solution without employee input or consideration of the employee's specific needs bypasses the interactive process and may not be effective or reasonable. Professionals should use a decision-making framework that begins with understanding the employee's limitations and the job's essential functions. This is followed by exploring potential accommodations, engaging in a dialogue with the employee, and evaluating the feasibility and effectiveness of each option. The process should be documented thoroughly, ensuring compliance with ADA requirements and best practices in disability management. Question 19. Investigation of the most effective strategy for addressing an employee's documented limitations that affect their ability to perform essential job functions, considering the employer's obligation to provide reasonable accommodation under the Americans with Disabilities Act (ADA). Option A. Focus on the employer's operational needs and inform the employee that the job cannot be modified to accommodate their limitations, regardless of potential solutions. Option B. Engage in a documented interactive process with the employee to identify specific limitations and explore potential job modifications or alternative assignments that enable performance of essential functions while assessing for undue hardship. Option C. Advise the employee that their current performance issues are a result of their limitations and that no modifications can be made to the job. Option D. Implement the employee's requested modification immediately without further discussion, assuming it will resolve the performance issue. Correct answer is B. Engage in a documented interactive process with the employee to identify specific limitations and explore potential job modifications or alternative assignments that enable performance of essential functions while assessing for undue hardship. Explanation. Scenario analysis. This scenario presents a common challenge in disability management where an employee's medical condition impacts their ability to perform essential job functions. The core difficulty lies in balancing the employer's operational needs with the employee's right to reasonable accommodation, all while adhering to the Americans with Disabilities Act (ADA) and its implementing regulations. The employer must engage in an interactive process to identify effective accommodations without causing undue hardship. This requires careful consideration of the employee's limitations, the job's requirements, and available resources. Correct approach analysis. The most effective approach involves a collaborative and documented interactive process. This means actively engaging with the employee to understand their specific limitations and exploring potential accommodations that address those limitations while allowing them to perform the essential functions of their job. This aligns with the ADA mandate for reasonable accommodation and the requirement for an interactive process to identify suitable modifications. Documenting this process is crucial for demonstrating compliance and good faith efforts. Incorrect approach is analysis. Focusing solely on the employee's request without assessing its feasibility or impact on essential job functions is a failure to engage in the interactive process and could lead to an unreasonable accommodation. This neglects the employer's responsibility to ensure the accommodation does not cause undue hardship. Implementing a modification without consulting the employee or assessing its effectiveness for their specific limitations is a superficial approach. It fails to address the root cause of the performance issue and may not provide the necessary support for the employee to succeed, potentially violating the spirit of the ADA. Dismissing the possibility of modification due to perceived inconvenience or a belief that the employee should be able to perform the job as is, without exploring reasonable alternatives, demonstrates a lack of good faith in the interactive process and a potential violation of the ADA accommodation requirements. Professional reasoning. Professionals should approach job modification and accommodation by initiating and diligently participating in the interactive process. This involves open communication with the employee, gathering medical documentation to understand limitations, identifying essential job functions, brainstorming potential accommodations, and evaluating their effectiveness and feasibility. Documentation of each step is paramount. When faced with a request, the professional should consider: 1. Does the employee have a disability as defined by the ADA? 2. What are the specific limitations impacting their job performance? 3. What are the essential functions of the job? 4. What accommodations are available that would enable the employee to perform these functions? 5. Would any proposed accommodation cause undue hardship to the employer? This systematic approach ensures compliance and promotes a supportive work environment. Question 20. What factors determine the selection of appropriate tools and instruments for disability evaluation within the scope of Certified Disability Management Specialist (CDMS) practice in the United States, ensuring compliance with relevant federal and state regulations? Option A. The validity and reliability of the instrument for assessing functional capacity in relation to essential job functions, alignment with CDMS scope of practice, and compliance with U.S. disability laws such as the Americans with Disabilities Act. Option B. The ease of administration and cost-effectiveness of the assessment tool, regardless of its scientific validity or specific relevance to the individual's job. Option C. The preference of the employer for a particular assessment method, even if it is not evidence-based or legally compliant. Option D. The use of generic, non-job-specific psychological questionnaires as the primary means of evaluating an individual's ability to perform work tasks. The correct answer is A. The validity and reliability of the instrument for assessing functional capacity in relation to essential job functions, alignment with CDMS scope of practice, and compliance with U.S. disability laws such as the Americans with Disabilities Act. Explanation. Scenario analysis. This scenario presents a common challenge in disability management. selecting the most appropriate evaluation tools when faced with a diverse workforce and varied job demands. The professional must navigate the complexities of ensuring the chosen instruments are not only scientifically sound, but also legally compliant and ethically defensible within the specific regulatory framework governing Certified Disability Management Specialists, CDMS. The challenge lies in balancing the need for objective data with the subjective nature of some disabilities, while also considering the practicalities of implementation and the potential for bias. Correct approach analysis. The correct approach emphasizes the selection of tools that are validated for the specific population and purpose, aligned with the CDMS scope of practice, and compliant with relevant U.S. federal and state disability laws and regulations. This includes considering instruments that assess functional capacity in relation to essential job functions, as mandated by laws like the Americans with Disabilities Act, ADA. The focus on evidence-based practice, cultural competence, and the individual's ability to perform job tasks ensures a fair and objective evaluation that supports appropriate accommodations and return-to-work planning. This approach upholds the ethical principles of beneficence and non-maleficence by prioritizing the individual's well-being and avoiding harm through inappropriate assessments. Incorrect approach is analysis. One incorrect approach involves relying solely on subjective self-reporting without objective functional assessments. This fails to meet the requirement for objective evaluation and can lead to inaccurate determinations, potentially violating the ADA emphasis on essential job functions and reasonable accommodations. It also overlooks the importance of functional capacity evaluations, FCE, or similar objective measures. Another incorrect approach is the exclusive use of generic, non-job-specific assessment tools. While some general assessments may provide baseline information, they often lack the specificity needed to determine an individual's ability to perform the essential functions of their particular job. This can lead to misinterpretations and inappropriate recommendations, potentially contravening the principles of individualized assessment required by disability law. A third incorrect approach is prioritizing cost-effectiveness or ease of administration over the validity and reliability of the assessment tool. While resource management is important, the primary ethical and legal obligation is to conduct a thorough and accurate evaluation. Using tools that are not scientifically validated or appropriate for the context can lead to discriminatory outcomes and legal challenges, undermining the integrity of the disability management process. Professional reasoning. Professionals should adopt a systematic decision-making process when selecting disability evaluation tools. This begins with a thorough understanding of the individual's condition and the specific demands of their job. Next, they must research and identify assessment instruments that are evidence-based, validated for the relevant population, and aligned with the CDMS scope of practice. Crucially, they must ensure compliance with all applicable U.S. federal and state disability laws and regulations, such as the ADA and its implementing regulations. Ethical consideration, including cultural sensitivity and the potential for bias, must also be integrated into the selection process. Finally, the chosen tools should facilitate the development of a comprehensive plan that supports the individual's return to work and promotes their overall well-being.